Apologies, folks. We're going to try this again.
Welcome back, folks. Sorry about this technical problem. We're just going to give it a second and hopefully stay in this time. Thank you for bearing with us. All right, I'm going to start screen sharing again, Steph, and I think we should be good, hopefully, to pick it back up.
Okay, everybody. Next slide on the marketplace changes. So the bill also made changes to the ACA marketplace and made it more difficult and more costly to enroll in the marketplace. We are, as Nadine mentioned, Illinois is administering a state-based marketplace called Get Covered Illinois beginning January 1, 2026, with enrollment beginning this fall. The biggest thing that will cause losses of coverage in the marketplace is the failure of this bill to extend the enhanced advanced premium tax credits. So basically, we've had larger financial assistance and discounts for people in the last 4 years due to enhanced tax credits. These enhancements made the tax credits that people get way more generous, and they expire on January 1st, 2026. Now, just because the bill didn't extend them, they still could be extended. We have until the end of this year. If the federal government can do so, this will stave off tremendous losses in the marketplace, but otherwise the cost of coverage will become much more expensive, and we expect to lose a lot of people and increase the number of people who are uninsured. It may be politically difficult, but this is one of the things we're really going to fight for, is to get these enhanced tax credits extended. So it's not over yet. The other changes that the bill made, that they've made through rule and through the statute, just makes insurance harder to get, more expensive, and the whole system more burdensome. As you can see, this is already a theme, right? They're trying to make getting covered more expensive and more burdensome for everybody in Medicaid and the marketplace. So it rescinds limits on how much a person might have to pay back if their income changes. So if your income goes up and down, you used to be limited in how much you had to pay back in financial assistance. That's gone. It greatly limits non-citizen eligibility for financial assistance in the marketplace, which we'll be going over in more detail in the immigration section, and also with our links to the full immigrant webinar. It also imposes very burdensome pre-enrollment verification of eligibility for financial assistance, stops the automatic re-enrollment of people with financial assistance, which was a great policy that helped to re-enroll people every year into marketplace coverage, and it ends a very important special enrollment period for people with low income. So those things, and remember also, as I mentioned, that ACA adults who don't meet work requirements or can't prove that they do also can't get into the marketplace if they fail to be eligible for Medicaid. So again, these changes, which Illinois will try to mitigate as much as possible, are another source of loss of coverage. And now I'll turn it over to my colleague, Carrie Chapman.
Hi, everybody. The bill includes a lot of changes on immigrant eligibility. And the truth is, today, we can't go over all of these in extreme detail. Otherwise, this webinar would last 3 hours. And none of us have that kind of energy on a Friday. So as Stephanie referenced, there was a webinar previously that really detailed changes to immigrant eligibility under the bill. And thanks so much, and all credit to Andrea Kovac at the Shriver Center, who was key in putting that slide deck together. And we will make that slide deck available to everybody. What I'm going to do today is kind of go over at the 30,000 foot level, the global changes to immigrant eligibility. So I am not going to dig down into the weeds of particular, very specific small number of people's statuses, but there is great detail in that slide deck, and it's coming. Okay, so as I think Nadine mentioned originally, emergency Medicaid exists to reimburse hospitals for emergency care that they provide, particularly to immigrants who are not eligible for traditional Medicaid because of their immigration status. And essentially eligibility for emergency Medicaid, which is really hospital reimbursement, not comprehensive coverage for individuals. But reimbursement for emergency Medicaid tracks the Medicaid category that you would be in if you were eligible. So if your income or income and assets are low enough for Medicaid, but your immigration status makes you ineligible, then the federal reimbursement tracks your Medicaid category. And so ACA adult eligible folks who are barred from Medicaid as a result of their immigration status were reimbursed at our ACA FMAP in Illinois and all states, which is 90%. And so the reconciliation bill reduces the FMAP for emergency Medicaid for all states that have expanded Medicaid. And so it's going down to every state's base rate, and Illinois' base rate is 50%. And so it's a pretty significant cut for us to go down from 90% FMAP to 50% FMAP for this particular category of services, emergency Medicaid, which can be very expensive. But it's particularly painful because as a result of other changes in the bill, immigrants will lose eligibility for Medicaid. So the number of people who will need emergency Medicaid goes up, and our federal match rate goes down. So it's kind of a two-stage cut. Okay, so again, impact. It's a significant cost shift in and of itself. It's a double cost shift as a result of the bills making many immigrants ineligible for Medicaid. And I think what's important to understand about anything that is a cut, and all of these things are cuts, is that cuts put pressure on the whole system, right? If we take money out, federal money out of the Medicaid program, that's puts pressure on all of the money we have for the Medicaid program. So people, I think, well, we sort of cut this, benefit, we cut this service, we lose federal money, and that is the only sphere affected, but it's not, right? If we have more people eligible for emergency Medicaid because their coverage is cut, that puts financial pressure on the whole system. That means we have to look at the whole system to figure out how to make cuts. So that's why we are concerned about every piece of this bill. This is one balloon of money, and a cut anywhere puts pressure everywhere. Next slide. Okay, so the general changes to federal Medicaid eligibility at a flyover level is that individuals who were eligible and are currently eligible for federally reimbursed Medicaid, for FMAP Medicaid, a portion of them are losing their eligibility as of October 1st, 2026. And Andrea from Schreiber created this great chart that lists folks whose eligibility will stay and folks whose eligibility will go as of October 1st, 2026. And again, this is their eligibility for federally funded Medicaid, for that, match of cooperative federalism. And so the big list is refugees and asylees. So if your status is that you are a refugee or an asylee, you are currently getting federally matched Medicaid. As of October 1st, 2026, you will lose that eligibility for federally matched Medicaid. Next slide, sorry, Kathy. So big picture takeaway, a lot of immigrants who have eligibility now for federally reimbursed Medicaid, who have statuses other than being an LPR, are going to lose it. So a lot of folks are losing their Medicaid, federally funded Medicaid eligibility as of 10/1/26. If those individuals can become lawful permanent residents, if they can adjust to becoming LPRs, their eligibility will continue, and will continue without being subject to the 5-year bar that LPRs are generally subject to. So 5 years after they become an LPR, they're barred from getting federal benefits. And that bar won't apply. But refugees and asylees, for example, as the two biggest groups, are going to lose their eligibility unless they can become an LPR. And as everybody who is works with immigrants understands, right, there may be many, many reasons why refugees and asylees, it's not safe for them to get a green card. All right, next slide.
Hey, Carrie, before
Yeah.
we move on, there's a question right now that I think would be easiest to address, which is are the immigration eligibility changes for adults only or for children as well?
So the federal bill, I don't think makes any distinction between adults and children, but I'll unpack that a little bit. But somebody who, if anybody knows, it's my understanding it doesn't make any distinction based on age. So they're just cuts. But 1 second and we'll talk more about that. Okay, so how does this affect Illinois Medicaid programs? So for ACA adult Medicaid, folks are going to lose eligibility within that program group. So it's really ultimately after 10/1/26 only going to be LPRs, some Cuban and Haitian entrants, and some other small groups of folks that are going to be eligible for traditional ACA federally funded Medicaid. Likewise, for Medicaid for people with disabilities and older adults, people 65 and older, same restrictions are going to apply. Same folks are going to be eligible. Same folks are going to lose eligibility. Next slide. Oh, no, back one. So, Illinois currently, for example, covers all kids. So we use federal funds to cover kids who can get federally matched Medicaid, and we use state funds to cover kids who cannot. The bill itself, the bill out of Congress, does not change the eligibility criteria for all kids. So nothing in the bill itself will change the eligibility for health coverage of kids who are, for example, refugees and asylees. It would only be change in Illinois law that would change eligibility for those kids. And Illinois is committed to providing health coverage for all kids for decades and decades now. But it's certainly going to be a point of advocacy to ensure that kids who previously were able to get federal match, who now can only be funded through state funds, continue to keep their coverage. That's going to be something we're all going to need to pay attention to and work on. And moms and babies funding is complicated, but there are possibilities of keeping moms and babies eligibility with state funding. And there may be some loss of federal funding in this category. But again, right now, state law sort of dictates who we cover in this program, and the federal law doesn't change state law. We might make political decisions and legislative decisions to make changes, but the federal law does not force changes in our laws. So HBIS, we know that it's closed for new enrollment, but it is not impacted in terms of eligibility by something that happens at the federal law because it's a state program funded with state money. And we don't expect to see it grow in the near term because it's closed for new enrollment, but it might be an area to capture some folks who have lost federal Medicaid eligibility if we as a state choose to invest in it. And then we have the VTTC AATB Medical, which again is a state program funded by state dollars, and the bill does not change eligibility for that. What the bill does is creates pressure on our state funded programs, but it doesn't change eligibility for them. Next slide. So this big picture restriction of who's eligible for sort of federal match, federal, support includes the premium tax credits. So if you compare these two charts, the folks who are keeping eligibility for those premium tax credits and losing them is basically identical to the chart about federally funded Medicaid. So folks like refugees and asylees, again, I'm just pulling them out because they're the two biggest categories, will lose eligibility for the premium tax credits to buy plans on the marketplace and have them subsidized on January 1, 2027. And obviously our concern about that is that those premium tax credits make the insurance affordable. It's really expensive to buy on the marketplace without those premium tax credits. And so it's really concerning for folks to lose their eligibility. It basically means that they're going to be ineligible for marketplace insurance because it's going to be unaffordable. Next slide. In addition, the ACA allowed lawfully present immigrants, which is a very big bucket of people, right? That's a very broad bucket of people who are lawfully present. It doesn't just mean LPRs. It's a broad bucket of folks who were earning up to 100% of the federal poverty level to get subsidized marketplace coverage, even though in general, the ACA says if you're at or below 100% of the FPL, you don't go to the marketplace, you're shifted to Medicaid. But because they weren't Medicaid eligible, the ACA allowed for them to buy on the marketplace, which did have a cost, but to get subsidies for that purchase. And under HR 1, it eliminates the provision allowing those lawfully present folks who are ineligible for Medicaid due to their status and who earn less than 100% of FPL to enroll in ACA coverage and to get the tax credits. And so this now means that immigrants who have lost their federally funded coverage option are now put into this bucket where they are also prevented from being able to purchase on the marketplace, getting subsidies on the marketplace. And so again, sort of it's that balloon thing, right? We're pulling eligibility from folks flat out, and then we're closing other doors for them to access coverage. And this is allegedly applicable to tax years beginning essentially January 1, 2026. Next slide. Oh, wait, I'm sorry. Can we really quickly go back to the previous slide? So I think one thing that it's important to understand here is that this is a bit of a double whammy because we are limiting folks' ability to have Medicaid. We're restricting their Medicaid eligibility, and then we're also shutting the door to the marketplace for them. And so we're going to see pretty significant potential impacts on immigrant eligibility. Sorry, Kathy, go for it. And then really quickly, I want to talk about Medicare changes. So right now, well, not right now, previous to the passage of the bill, immigrants could enroll in Medicare if they qualified. So residents of the US, including citizens and permanent residents and a huge group of folks, were eligible if they had sort of generally met the requirements for Medicare, if they had 40 quarters or 10 years of work on the books where they paid in, Medicare taxes. And they were either 65 years old or met the criteria for Social Security disability. They were eligible for Medicare. Now we are imposing on Medicare the same restrictions that we are imposing on Medicaid and the ACA, which is carving out eligibility, making ineligible that whole list of refugees, asylees, et cetera, and only carving in lawful permanent residents, green card holders, certain Cuban and Haitian entrants, and people residing under compacts of free association. And so we are indeed also changing Medicare eligibility, in spite of the fact that people have the quarters of coverage and meet the age or disability criteria. And so this is a significant restriction of access to a program, becoming ineligible for a program as a result of this bill. It's a little bit odd because the Medicare changes are effective immediately upon passage of the law, and a couple of sections were basically immediately upon passage of the law. But people enrolled in the program can apparently remain for 14 months from July 4th, 2025. So there's some kind of grandfathering in. So you're not going to be able to get on Medicare newly, but if you were receiving Medicare, there's sort of a wind down period for you. Again, your other insurance options are extremely limited. And so this is sort of a pretty substantial cut in Medicare eligibility. There are potentially some fiscal impacts in the bill for the Medicare program overall. We're not going to talk about them today because they're a little bit abstract. The chickens really haven't come home to roost, but you're going to probably hear discussions about overall cuts to Medicare. And what I would say is we're going to take those issues as they come. Today, we're just going to talk about what's happened recently. Next slide. Okay. We have dumped a lot of information on changes. You can go to the next slide. Sorry, Kathy. This is a chart from HFS about when provisions of the bill go into effect. I think it's a handy dandy shortcut chart. And then next slide, Kathy. There are fantastic summaries of bill language and timeline. Every aspect of the bill, every date of implementation, things we just haven't had a chance to time to talk about today. And so when you are able to access the PowerPoint, all of these links will be live, and they are terrific resources. And we really encourage you to go to them to get specific questions answered and to get timeline questions answered. We have vetted all of these sources for you. And now I'm going to turn it over to Naya.
Hi, thank you so much, Carrie. Good morning, afternoon, everyone. Naya Kelly. I am the Director of State Legislative Policy, Equity, and Transformation over at the Chicago Coalition to End Homelessness. Kathy said at the top, I'm sad that we have to have this webinar, but happy that we are able to share information with you all. I know that this is a lot of information to digest and not even digest, but to hear and then sit with for a bit. But Nadine mentioned not leaving this space with this feeling of hopelessness or without knowing that there are things that we can be doing. So in terms of next steps, next slide, please. There are a couple of things that we want to talk about and just basically start with saying we will fight back. This is not over. Despite this legislation becoming law, there are going to be a couple of ways that we are going to move forward, both at a systemic way as well as on these are our neighbors mindset. And so we are seeing, what our hope is to narrow or to remove some of these eligibility requirements that are being put in. One of the things that that's included is that they're hoping to allow for to take away states' rights to be able to provide for optional services. These services include dental, physical therapy, occupational therapy, speech and hearing, prescription drugs, dentures, prosthetics, eyeglasses. As we are thinking about how we move forward, making sure we know that healthcare is this vast umbrella. As someone who works in housing, I say that housing is a human right, but I also say that housing is healthcare. And so all of these things exist under this umbrella. And at the state level, there are ways for us to think about how we engage and think about making sure that people still have access to these things. Next slide, please. So over the next 2 years, we're going to see changes in benefits. Not like some things went into effect immediately. Some of them it's going to take some time. Carrie and Stephanie spoke about this, and Kathy is going to, or Beth is going to speak about what's going to be happening with SNAP. A lot of the things that are in the bill are confusing, and some would say that it is intentional confusion, and some would just say that there are people at the federal level who don't truly understand how government work, and so the confusion is just that they are inept in making decisions in their cruelty. So one big concern is that everything is going to be in constant movement. We hope that we can serve as a space where people can get information. We understand that everything could be changing minute to minute. We know that Democratic attorney generals and governors across the country are going to be filing lawsuits. And with these court cases, these decisions will end up either changing things or keeping things as is. And so it's going to be a moment by moment information that is going to be shared. And so we hope that this space in POCIL and our individual organizations will serve as a space where people can get good information. We know that advocates and stakeholders can partner and problem solve, both on a systemic level as well as on an individual. Illinois, is well positioned to avoid and mitigate some of these harms. HFS and IDHS historically have have worked both with advocates as well as their customers. And we know that with all of these changes, it's going to be a lot of changes for HFS and DHS, and it is going to be a learning curve. And so as much information sharing as we can do, we will do. We know that this is going to impact our healthcare systems as well with our hospitals, our service providers, our clinics that are in the community. And so creating space for all of these entities to talk together is going to be key. And making sure that we're creating channels for advocates as well as for everyone to get as much information as they can. Next slide, please. So states will retain, one of the reasons that we know that work requirements and the red tape that goes along with it doesn't work is because we saw what happened in Arkansas when they attempted to implement work requirements. We were able to get so much data from that huge failure. During the Biden administration, during Trump 1, they allowed for these waivers. During the Biden administration, they repealed and told states we're not doing this anymore, but we were able to get a lot of data. What we want to do over as we are implementing or as these things are going into effect is making sure that we're getting as much information as we can and hope that when we get to the other side of this administration and we try to claw back the Medicaid as it was and even make it better, because what we had is the baseline. We want to expand access to healthcare, making sure that we're tracking the data under this so that when we go back and we say this did not work, we already know it's not going to work, but making sure that we can show our work when we get into a better place. Fingers crossed that we make it there. And so we are, as a group, some of our recommendations include creating special state mechanisms for funding health coverage and care. We know that Illinois, like every other state in the union, is not going to be able to pick up the slack. Whether, like, we know there's always conversation about each year Illinois is, we have systemic issues when it comes to revenue in the state and being able to pay for important services. So we are not alone in this in terms of being able to pick up the slack. This is money coming from the federal government. No one has the ability to fill that gap. And so what we can do, we should do, and finding revenue opportunities is going to be key. We want to make sure that we're using the Medicaid advisory committees as well as the beneficiary advisory councils to get ideas from all stakeholders about how to better respond. We want to build a robust administrative record about the cost and the impact, as I shared before. We want to sue as much as possible. As an attorney, I always say, like, hate litigation, but sue, baby, sue. That is where we're at. When we have the opportunity and when our state has the space to, we should be suing the federal government and making sure that notices are timely, clear, and actionable, and then making sure that we're tracking coverage loss. As I said, we want to be able to show our work. Next slide, please. So, in terms of, you know, Illinois' response around this, Illinois is launching a state-based marketplace this year, which allows for additional flexibility in crafting state solutions for those eligible, and can learn from other states such as Colorado and Washington about creating a state-based public option. Illinois has an opportunity to find revenue for programs. We love revenue over here. For ACA adults terminated due to work requirement challenges. And so, you know, I'm just gonna plug that each year I've been working as an advocate at our in our state capitol for the last 10 years. And I know, as well as other advocates, and I think several members of our legislature, that we have to find systematic revenue options, and we can point to right now why it is needed. We are going to see people losing benefits both in the healthcare space as well as for food access. And right now, at the front of my mind is the executive order that came out yesterday around homelessness. And so all of these things are being attacked at once. And we know that people are not just living in silos. People who need access to childcare, need access to SNAP benefits, that need access to Medicaid, that need access to housing. So people do not exist within this frame of mind of just needing one of these things. All of these systems are being attacked right now. And as a state, we have to come up with a comprehensive plan, understanding that, again, we're not going to be able to fill all of the gaps. We do have the opportunity within our legal system to be able to try to hold off on some of the cruelest parts of what the federal government is doing. Next slide, please. So we're going to build coalition. We're going to build consensus. We're going to have conversations with each other. We are going to be having conversations with our legislature. You know, I know that the chair of our Human Services Appropriations Committee in the House, Hi, Representative Moeller, is on. And so we are hoping to host subject matter hearings. Some of the things that we did during the spring session to inform people and to inform both Democrats and Republicans when folks were saying that we were these were scare tactics and that it was political performance. We know where we are now. We're going to continue those conversations. We're going to be talking to our federal delegation, Congressperson LaHood and Boston Miller, who voted for these changes, and you know, holding them to task and seeing what ways that we can fend some of these things off. We're going to find ideas, and we are going to make sure that when we are in a better place, that we are positioned to be able to hit the ground running. With that all being said, I am going to turn it over to my colleague Beth. Thank you all so much for being here today. And don't, you know, have a moment where, you know, you sit with it, but know that we have a fight ahead of us, and this is not the end. This is just the beginning of us continuing to say we deserve better. I appreciate you all.
Thank you, Naya. It's always hard to go after Naya and all the other folks on this call, but my name is Beth Kenefick. I lead our policy work at the Greater Chicago Food Depository, and I'm here to give a very brief overview of some of the SNAP changes. Similar to what everyone has said, it's a lot, it's really heavy, but we do believe that there are places in which we can push back and try to mitigate harm. I'm also just going to give a high-level summary, and so my colleague Rodolfo will drop a couple of links into the chat that have some additional details, as well as a webinar that we're hosting next week that will go into this in a lot greater detail. So with that, I think echoing what Naya said, we think that food is a basic human right, and food is also healthcare. And that's why we are here. We are, as a Greater Chicago Food Depository, we have been as part of Protect Our Care since it sort of came back last November, but really wanted to be here today to talk about some of the other big changes in the bill. Before I talk about the $200 billion of cuts in SNAP, just wanted to give a quick grounding of what it is and why we think it matters. So SNAP, or the Supplemental Nutrition Assistance Program, which is formerly known as food stamps, is the primary source of nutrition assistance for almost 2 million people in Illinois. We know that SNAP helps lift people above poverty. It also has an economic activity. Every benefit that was received and spent is generally a 1.5 in economic activity in our country. And it also helps reduce the risk of diet-related diseases. Now, you might be thinking, as a food bank, why am I here speaking about this? That's where looking at this sort of orange graphic on the right is important. For every meal that a food bank in the Feeding America network across the country serves, SNAP provides 9. So right now, the emergency food system, which we're all seeing record high of people coming to our food banks, does not have the capacity to fill the hole if we are to lose SNAP. Next slide. So what did they do to make the $200 billion in changes? Unfortunately, like we saw with Medicaid, extremely cruel and disastrous things, and along a lot of the same themes. I'm going to sort of go a little bit deeper into 2 of them, the work requirements and the state cost shifting, but just wanted to flag some of the other things. It's cutting the thrifty food plan and the ability to sort of let SNAP benefits grow in the future. Similar to the changes we saw in Medicaid and Medicare and the marketplace, it's borrowing SNAP benefits for legally present immigrants. So particularly cruel to sort of go after folks that have come here under the most extreme moments of distress. There are also probably a number of folks on this call that know the SNAP Nutrition Education Program. That program is eliminated and is currently ending at the end of September unless there's additional federal funding. Thank you. So in terms of work requirements, so SNAP has had work requirements, unlike Medicaid. There is a general sort of thing around SNAP that you are supposed to be working, but then there's a sort of different component in population that are supposed to meet work requirements, and if not, there's a time limit. And so you can only have SNAP for 3 months within a 3-year period if you are not meeting these sort of burdensome paperwork requirements. Illinois has not been sort of asking SNAP recipients and our neighbors to meet this work requirement or sort of comply with it at the moment because we've had a waiver, a statewide waiver since before the pandemic. And we had that waiver because of high unemployment and low access to jobs. SNAP is often seen as an economic sort of support when we have recessions and people lose jobs, they can go on SNAP. And so waivers allowed us to sort of say, we're in an economic recession, we know that people can't find work, but they should still have access to food. So the bill did sort of 2 things. It's restricting states' abilities to have those types of waivers. So our current waiver, which ends at the end of January, cannot continue as currently is under statewide. The next change it made was it changed sort of the population with which falls into that time limit bucket. It's unfortunately named able-bodied adult without dependents. There's a lot of conversations around there are able-bodied adults that still also can't work, but it changes who falls into that bucket by changing who's considered able-bodied, making it older up to 65, and changing dependents, going from 18 to 14. So the state is looking at around 200,000 to 450,000 people will now fall into that population. It also removed some exemptions that happened, some exemptions for people experiencing homelessness, veterans, and former foster youth. slide. The other sort of deep dive I wanted to share is around costs. So we saw that there was a lot of changes to the FMAP and making it more expensive for the state to have to sustain Medicaid. The same thing is happening to SNAP. But unlike Medicaid, SNAP has always been federally funded since the program's inception. Again, it allows the program to grow and retract during recessions and make sure that people always have food. As part of this, the Congress is sort of forcing states into very unsustainable situations and also sort of setting us up to fail. So they're changing and saying that states now have to pay a portion of the SNAP benefits, and they also are changing our admin costs. Right now, the way that the legislation was set up, we're looking at around $700 million a year for the benefits, and then $100 million a year for the change in administrative cost. So about $800 million. This is based on a thing that's called payment error rates, which is something that we'll go into a little bit more depth on our webinar next week, because I think that's where we're starting to see some opportunity to be able to mitigate this problem. Next slide. And then the question that everyone always asks is, when do all these things take effect? Unlike the healthcare stuff, there weren't a lot of effective dates in the bill for SNAP, which means that they all theoretically took effect upon enactment or upon bill passage. That includes the work requirement changes, the changes around the waiver, the immigrant eligibility, and a couple of things on the utility deduction. However, our state, other states around the country have all sort of come forward and said that they are not making changes until they see further guidance from the federal government. In a traditional time, there's implementation memos, guidances, and other things that have to happen before these changes take effect. And that's the case right now with SNAP. So you will see on the IDHS website, on ABE and other things, but we're still saying that people should apply for SNAP as usual. As I mentioned, SNAP Ed funding ends at the end of this federal fiscal year, which is September 30th. Our current statewide waiver goes until January 31st. And then those two big sort of cost shift things happen October 1st, 2026 and October 1st, 2027. However, I will note the sort of time period that impacts what is the percentage of cost shifts that we would have to pay if we wanted to pay less than 15% is happening now. So there will be some more details next week, but we'll go into a little bit of what that means and what are sort of the opportunities that we all can do as legislators, stakeholders, community-based organizations, neighbors, to help the state sort of have a lower cost if possible. And with that, I will say we'll be here next week going into a little bit more depth about this. But just I'm glad to be here today with other folks on this call. And we know that SNAP and Medicaid, a lot of folks are on both. And so we really wanted to sort of react and respond and make sure that we're mitigating harm together so that we can make this as painless as possible for folks around Illinois. And with that, I will pass it over to King.
How everybody doing? Thanks for informing us on all of the things. Considering it was a lot, I don't want to, embark on too much information, but nonetheless, and organizing and accountability, I want to just highlight a few things that's important and vital at this time. And so, yes, I am King Musa with Citizen Action Illinois, organizing manager in Rockford. So, where are we now? I want to talk about two organizing goals during this phase that we're fighting. Thanks for going to the next slide. I want to talk about the importance of defining this as an attack, right? We got to continue to tell the truth about this bill as it is an attack against the people on the ground. It will raise the cost of living for working families. It will put a bigger burden on the state budget. It will take away services from veterans, from people who are disabled and kids And so we want to continue to push that narrative because the fact that this, as y'all just heard, the implementation of this bill is prolonged. So it gives the opposition an opportunity to not necessarily have to tell the entire truth about this bill. So they can run next year campaigns and talk about how great this bill is and disguise it as such beautiful thing as they called it. And then they can hide it because the Americans won't necessarily feel the impact right away. And so we have to be keen and stern about keeping this narrative going about the truth. Hey, this is an attack. It's taken away from us and given to people who don't necessarily deserve our tax money or even need it. And it's continued to oppress us, and we have to continue to keep that on the forefront. They have already, called this a bill that's great, and it's a tax break for middle class Americans. Even the Washington Post one time saying that this bill will help with our gym membership costs, bringing it down. So things like this it's vital that we continue to mobilize around the truth, right? And doing that, we're going to do activities like on July 30th, we have events planned in Chicago, Carbondale, Illinois. We have events in Peoria, Illinois, where we're calling it a bleak birthday because we will be celebrating 60 years of Medicaid and Medicare, but also it's coming at a time where they're stripping away some of that funding to these programs. So we want to, yes, indeed, celebrate how far we've come, but then at the same time, remember how far we have to go because of what's happening right now. So we'll be doing this celebration on July 30th in different states. If you are in any of those cities, Chicago, if you are in Peoria or Carbondale, please find this on Mobilize. I hope to drop it in the link drop a link in the chat if one hasn't been dropped already. Yeah, and so we also would be throwing healthcare is human rights town halls. And at these town halls, we have elected officials. We have elected officials coming to the south suburbs. We have Representative Mary Gill, Representative Rick Ryan, Senator Bill Cunningham. We have Representative Maurice West in Rockford, Illinois. In East St. Louis, we have Senator Chris Belt. If you know a legislator or anyone that elected official that will be down to do one of these town halls, please let us know, as we need to continue to, inform the people and show people from a policy level that we still have an angle and we still have ways to go. And this fight isn't over just because this bill has passed. So it's important that we continue to mobilize and organize during these town halls and rallies and demonstrations. Also, we have been calling out every week, every Friday at noon, the constituents of Darren LaHood, Mike Boss, and Mary Miller. We have been calling them, patching them through to their office, and they have the opportunity to express their concern and their opposition on them voting yes for this bill. And so it's just important. It's important that we continue to fight, and we could even at this point where we feeling like we're down bad and we up against the ropes. There are angles to still win this fight. We can even continue to build in order to stop the implementation of some of these things. If there's enough power on the ground, the states can stand behind us and not necessarily carry out this bill in which they wish it to be carried out. So, so in closing, I just wanted to say it's important that we continue to fight on the side of the truth. And those mobilized links will be dropped in the chat. If you are in any of these cities, feel free to come out and support. Again, we're going to celebrate how far we've come and just come in community and also recognize how far we have to go, being that this bill just got passed and what's about to be implemented. So thank y'all for this opportunity. And now we will go on to resources.
Hi, that's me. Thank you so much, King, and to everybody who's presented. I appreciate the time and expertise of everybody, all of our panelists, and thank you to all of you for putting your questions into the chat. We've got 5-6 minutes left. We're going to answer some questions, so please continue to put those into the Q&A box. We have answered over 100 questions already. resources. Folks will receive the slides and the recording. They will go up on the website. So I'm not going to spend a lot of time here, but I want to highlight that we do have some important resources, including Help Hub, which is a forum that you need to join. You can request to join, but we will be sharing information for case managers, for people who are working directly with clients as guidance is released, as changes are happening. You can look for resources, answers, and be part of a live conversation. Help Hub will be a critical resource going forward. We've got a bunch of links. I'm not going to go over the links. There's national links. There's state-based links. You're going to find everything you need. On this slide, you see the Protect Our Care Illinois resources. It's protectourcareil.org. That is where we will be posting the recording and the slides. So at the end of this webinar, I want to go over what I heard as a couple of takeaways from my colleagues. First, the fight is not over. This was a bruising loss. A lot of us needed some time to sit with that. But we have time and opportunity to make the changes to Medicaid and SNAP less bad for people in Illinois. And we have an opportunity, an obligation, a passion to continue to fight for all people to have access to high quality, affordable health insurance and food. And we will continue to fight for that for as long as we have to. People who are most targeted, explicitly targeted by most provisions in the bill, though not all, are immigrants and folks enrolled in the ACA expansion population. Those are the folks who we know the most about how this will affect them, though regulation, guidance, lawsuits, a lot remains to be seen in terms of what that looks like. Those are the folks who are most directly targeted. However, cutting $51 billion in Medicaid funding to the state of Illinois will have a ripple effect through the rest of the Medicaid program, through our healthcare system, and through other places where the state spends money. Medicaid is the largest, historically has been the largest influx of federal revenue to our state. So we will expect to see over several years that this will have a long-term impact on our state's fiscal health, and we will see impacts across Medicaid. We do not know what those are at this time. We will have to work with the state to figure out how to figure something out, backfill funding where we can, look for creative solutions, undo the harm at the federal level, and try to enact as few cuts as possible. Help Hub is a great way to get information about that. Protect Our Care will continue this conversation to share with you what we see coming and how you can engage, what you need to tell folks. We have time. On Medicaid, the earliest that we're going to see changes take effect generally is late next year, many later. As of today, if I were talking to somebody enrolled in Medicaid, I would tell them nothing has changed. Access care, manage your case exactly as you always have. And I would tell somebody who is not enrolled in Medicaid but might be eligible to apply. On SNAP, while the law does have things taking effect immediately, the state has no information to do that. So as of today, use and manage your SNAP case, apply for SNAP as you would always. That is the only thing clients need to hear right now. We will help people prepare for changes as soon as we can tell them what to prepare for. But for right now, we want to make sure that folks have the most actionable information and aren't confused because there is a swirl of chaotic information around us. That's by design. So our job is to help people keep their eye on what they can do. If you want to help people navigate these changes, incredible. Love the impulse. We don't know what the changes look like yet. So please stay in touch. When we start getting to work reporting requirements years from now, we will certainly look at ways to help people fulfill those requirements and bring volunteers in and all of that into organizations that are open to that. We will let you know when those opportunities come. Finally, for those who are worried about our ACA adult expansion and our trigger in state law that would have ended the program, that was not triggered. There are a lot of changes affecting ACA adults. The most important thing to know is that's not triggered. Finally, we have 1 minute left. That went fast. There were a lot of questions about gender affirming care. So I want to reiterate. The bill initially included a ban on federal funding for gender affirming care for minors. That did not pass and has not become law. There is no change to federal Medicaid funding for gender affirming care. Marketplace has always had some restrictions. Those are also unchanged. Why are hospitals ending their gender affirming care? A much more complicated conversation that has to do with regulatory chaos, rhetorical chaos. There's no statutory change in this bill that is forcing that to happen. Those were all my takeaways. Thank you for for navigating the technology changes with us, or the technology challenges. We will continue to have conversations about this, continue to host briefings, share resources. So please stay in touch with Protect Our Care. Join the SNAP briefing next week. Look out for information about a DHS and HFS briefing. And thank you so much for your time.
Thank you, everyone. Take care.